Hi, my name is Vita. I live in Lymington with my two brothers, William and Henry, my mum, my dad, and many assorted animals. Over the next few weeks, and like many other teenagers across the country, I'll be starting my work experience placement, which I've arranged through my mum. As a head and neck surgeon, she works with many people who have swallowing and speaking problems as a result of cancers in their mouth, throat, and voice box. Cancer is something that we have all heard of, but not all of us really understand what it is and how it can affect us. I decided to spend the next few weeks finding out a little more about it.
Hi, nice to meet you.
I've come to Poole Hospital to meet Steffi, a patient who was diagnosed with cancer of the mouth. Steffi underwent major surgery to not only remove but also rebuild parts of her mouth and jaw that had been destroyed by cancer. She's kindly agreed to talk to me about this. Thank you for meeting with me today. So I understand that you were treated and diagnosed with cancer of the mouth. And I'm interested in what happened and what originally the symptoms were.
I first noticed a rough patch on my gum, just above one of my upper back teeth earlier in 2012. I brought this up at the next regular checkup with my dentist, and it was about March that year, and he said he thought it was the start of gum disease and that I'd needed to see a private specialist. I was quite short of money and I said I couldn't afford to do that, and so he prescribed antibiotics and a course of cortisol treatment mouthwash, and he said that I should leave it and see how it progressed at the next 6 month checkout. During this time, the patch got larger and quite sore at times. And when I returned 6 months later in September, he said he'd now refer me to an NHS specialist. Gum disease wasn't mentioned at all at this stage, but he said he thought it was an abscess or an impacted molar or something along those lines. He told me that there'd be quite a long waiting list and that it'd take a while for my referral to come through. By the sort of middle of 2013, beginning of 2013, I still hadn't heard anything about my own referral. By this time I was in quite a lot of pain, my teeth were loose and I was often bleeding in my mouth, my face was swollen and I was in quite a lot of difficulty eating. So I went back to the dentist in desperation in March 2013 and was finally referred to the hospital.
That was quite a significant delay, so did you go to see a GP at any point?
I didn't go to see a GP, I wish I had, but I had never heard of head and neck cancer, so it didn't occur to me that I would be involved in the GP with this at all. I totally and completely believed my dentist that these symptoms were maybe an abscess, impacted molar, something like that, or some root canal problem.
What happened when you finally saw a specialist? Did they tell you straight away that you had cancer?
Even when I was finally seen at the hospital, I still didn't know this could be cancer. The first inkling was when they said they wanted to do a biopsy, and from then it was just a round of scans and blood tests. The biopsy was on March the 20th, and I was finally given the cancer diagnosis on my 49th birthday on April the 10th. I had surgery on May the 16th, which was my wedding anniversary. The tumour was in my jaw. It was removed and they took some bone and flesh from my leg to reconstruct my face, and they also took the sinus from my nose. I was about 13 hours in surgery, about 6 days in intensive care, about another 12 days on the ward. I was obviously nil by mouth for about 6 weeks, and then I was just having liquids and building up to real food, so I was obviously on a stomach peg feeder. Following my first surgery, I had another little op to just remove a bit more so they were absolutely sure everything was gone, and then I had 6.5 weeks of radiotherapy. But that was all 3 years ago, and I'm cancer free, so they obviously did a good job.
That's quite an incredible story. Is there anything you've learnt from the experience and any advice you would give people who are coming up to maybe face the risk of cancer?
I would very much like everyone to know that head and neck cancer does exist. I wish I had known.
Yeah.
I wish I'd gone to my GP much sooner. So I think, if there's any query about it, go to your GP. But also be really sure, ask your dentist that they are checking for cancer, that they know about cancer, and they check regularly when you go into the dentist.
When a GP refers someone with a suspected cancer, they often send them to someone like Emma King, a head and neck cancer surgeon. I've come to talk to her about cancer, what it is and how it can affect us. So what exactly is cancer?
Cancer is caused by a collection of cells that divide too rapidly. Normally all cells are under very tight control, so they divide only when they're allowed to and when the body needs them to, and they're very tightly regulated by lots of signalling mechanisms. Unfortunately, in a cancer, those signalling mechanisms are lost, and therefore the cells reproduce more often than they should do, and that's what produces a lump essentially. It's a mass of cells that shouldn't be there.
Should we be worried about head and neck cancer in children? Is it common in children or not? And how can we prevent it from happening to us?
It's not, head and neck cancer is not common in children. We very, very occasionally see it, but it's not common and certainly nothing to be worried about. But we know that during our childhood we can influence how likely we are then to develop a cancer at a later stage. So for example, we know that children that smoke and go on into adulthood to smoke are 7 times more likely to develop a head and neck cancer.
Oh.
And those children that actually drink alcohol and significant amounts of alcohol are 5 times more likely to develop head and neck cancer. And put together, children or young adults that smoke and drink alcohol are 35 times more likely than someone that doesn't smoke and drink to develop head and neck cancer.
So smoking and drinking heavily is bad, but I also read that viruses can also lead to head and neck cancer. Is that true?
Absolutely. So we now know that 1/3 of our patients will present because their tumour has been caused by a virus. And this virus is human papillomavirus, or HPV. And you may have heard about that because that's the virus that we protect teenage girls from during the national vaccination programme. Unfortunately, we don't protect boys during the national vaccination programme, and they are twice as likely as girls to actually develop the cancer. So other things we can do to protect ourselves from the virus is practicing safe sex, because we know that the more partners that we're exposed to as teenagers, the higher the chance of contracting the virus and therefore putting ourselves at risk from actually developing the cancer.
So when you see patients like Steffi, do you treat them with their cancer first off? Do you get rid of the tumour straight away or not?
No, first of all, when we are referred a patient, generally from the GP, that's a patient that's someone like Steffi presents with a lump in the mouth, then we talk to the patient, we explain to them what's going on, and also explain to them that we need to do a number of steps before we can treat the suspected cancer. We do lots of images, things like MRI scans and CT scans, to better understand whereabouts in the body it's spread to, if it has spread. And we also need to take a biopsy of the lump in order to get histology. And histology means that we'll look at the tissue under a microscope, and that goes to our pathology department. And Dr. Hayder would be a good person to talk to, and she'll explain a bit more about that.
Dr. Chong is a consultant pathologist with a specialist interest in head and neck cancer. He works down here in the pathology department at Poole Hospital, where part of his job involves looking at samples that surgeons like Professor King send him. I'm meeting with him today to find out a bit about his job. So, Dr. Chong, what are you up to today?
Well, today I'm looking at some cancer specimens which are processed under glass slides in my microscope, and later on I'll be heading downstairs to surgically dissect a large cancer specimen.
And so how can you tell if a tissue is cancerous?
Usually by looking under the microscope, I will have to determine whether they are normal cells and whether they are mutated cells. Cancer cells are mutated cells, and they often look very bizarre compared to the normal cells. And also by their very behavior, they tend to invade and destroy nearby normal structures within the cellular matrix. So by then I can determine whether this is a cancer or not based upon this criteria.
So after you've found that if it's cancerous tissue or not, how do you make the treatment plans?
This is usually done by a weekly meeting or a collaboration between the pathologists, oncologists, surgeons, as well as the radiologists. And we'll discuss about the case and institute a management plan according to the fitness of the patient, as well as the extent of the cancer.
And so who in particular usually does this?
This is usually informed to the patient in clinic by the surgeon or the cancer nurse specialist.
Thank you. Sue is a CNS, which stands for a cancer nurse specialist. Sue has an important role in coordinating a patient's entire treatment plan and also making sure they have all the support they need as they progress through a difficult period. I just spoke to Dr. Hyder and she showed me what cancer looked like. She told me that you often talk to patients about their cancer and help the surgeons tell them that they have cancer. Is it difficult to tell them? Do people often get upset about it?
It can be very difficult to tell people that they've got a cancer diagnosis. People get upset, and of course they get upset. Nobody expects it, especially with head and neck cancers, I think. And it's our job to support them through this difficult time and to show them the treatment options and hopefully a curative treatment.
Yeah.
People act very differently. Sometimes they cry, sometimes they become hysterical, sometimes they're quite hysteric, and it's not until the next day that it actually sinks in. But we try and give them a treatment plan straight away so that they know what's going to happen to them, and we're there to support them with other disciplines, within our team.
Yeah.
It can be difficult, but it's a very important part of the patient pathway because they link with you, and right from diagnosis through to hopefully discharge from hospital, you're their point of contact.
So how do patients get managed?
Most patients want to get on with their treatment as quickly as possible, and we try and accommodate that as best we can because we don't want the cancer spreading, growing. And of course they want to get back to their lives as they've known it. Some 2,000 people die every year from head and neck cancer, and 1 every 3 hours dies of head and neck cancer. It's quite an aggressive disease. So really we need to be looking at ways to prevent the cancer, and this is what we're here for today, to highlight areas that you can be aware of.
Yeah.
How good you're going to be on the day.
It can take up to 5 years to confirm that cancer has been completely cured. Although the scare of cancer has gone, many patients are often left with the long-term problems with their voice, speech and swallowing. Much of my mum's job involves helping patients with these specific problems. Hi Mum.
Hello. What have you been up to? Learning lots about head and neck cancer?
Yes, it's been very interesting seeing what you do. But why do people get the long-term effects that they do after having cancer?
That's a good question. The problem with these cancers is that where the cancers are located is in an area that's vital not only for speaking but also for swallowing and breathing. And both the cancer and the treatment itself causes damage to those very finely balanced areas, and people are often left with long-term effects both from the surgery and the treatment. So my job is to try and rehabilitate patients and get them a better quality of life.
Do you manage to help all of the patients?
Well, we certainly try, but a lot of them have very severe changes from the cancers, and it can be very difficult to really make a much improvement, and many are left with lifelong problems.
How will things change in the future? Are you any closer to finding the cure for cancer?
Well, we certainly know a lot more than we did even in the last 10 years. People like Emma King working very hard to develop treatments and make improvements into the future, but there's still a lot of work to be done. You ought to go and spend some time with them in the research lab and see what they're up to.
Ollie is a researcher based at the University of Southampton. Much of his work involves learning more about cancer above what we already do, and I was lucky enough to spend some time with him looking at cells in the labs.
What your questions
So
are?
Ollie, tell me about your role as a researcher.
So my role here is I'm a research scientist. I work on head and neck cancer, and primarily in the last few years I've been looking at HPV-driven head and neck cancer, so tumours caused by HPV, which is a virus, and then also the same tumours which are not caused by HPV. So I work with Professor Kristen Ottensmeyer and Emma King, who's a surgeon in Poole. We kind of work quite closely together, and then fundamentally we're just trying to understand what's in these tumours really.
So what mainly is your research on apart from...
So the main focus at the moment is looking at the HPV tumours and the non-HPV tumours, and trying to understand whether or not you can get a benefit from the immune system. So we're trying to look at whether or not we can use the immune system to actually defeat the cancer in certain types of patients. So we can give people vaccines that may target particular things in the tumour, and that will actually reduce the amount of tumour in these patients. So by understanding the tumour and what's inside it, we can hopefully help patients and actually reduce their tumour size and hopefully treatment, really. That's the fundamental goal.
So what's the big future of head and neck science?
So the future for head and neck cancer, really, I suppose, is kind of already happening here. So there are probably 3 clinical trials happening at the moment where we are. One of them's looking at a particular drug that tries to promote infiltration of immune cells, so your own immune cells, into the tumour to try and destroy it from within. And another one is using a vaccine against the HPV, similar to what you would have had as a sort of preventative vaccine, like you have a flu shot, you have a HPV vaccine. What we're trying to use those same vaccines, but with people with cancer, to try and use your immune system to destroy the tumours. So the next level of things is actually specifically understanding each tumour and how it's arisen within the patient, and then targeting it specifically. So each person will have a very unique tumour, and what we're trying to do is understand those unique features and then target them to destroy them.
Okay. And is it a slow process?
It does take time. So research can take a very long time, but it's quite rewarding, but it does take a long time. And a lot of hard work.
It's been an interesting couple of weeks. I've learned a lot about head and neck cancer and what a scary condition it can be. I've seen how it is managed and how many different people work together to help people with cancer. It's also been really good to see all the effort that is going into future advances in understanding cancer. At this time, in June 2016, girls at the age of 13 will receive a HPV vaccine, and this will significantly reduce the risk of developing viral-related cancers in the future. As we speak, vaccinations for men are also being considered on a national scale and are being debated in Parliament. If you want to know more about cancer, or if the things we have spoken about are familiar to you, you can find more information online at the Cancer Research UK website and also at help websites like smokefree.nhs.uk.